Hi Ready Set Mums, welcome back. If you are still with us, you are now in your 39th week of pregnancy, which means you are 1 week away from your due date and you have seen 9 months of pregnancy now. Now your beautiful baby is about the size of a pumpkin. So he or she weighs about 8 pounds and they are about 19 to 20 inches in length. Now your beautiful baby is still developing. They now have that rooster, it's so excited for you. They now have tear ducts even though they aren't open, and you might be noticing some side effects with the weight that is now bearing down and the loosening of your ligaments and different muscles in your body with the hormones that you are generating to help everything stretch when you deliver your baby. So with that can come some pelvic pressure. You might also notice some pains and some niggles, and sometimes pains and niggles can be early signs of labor and you might be confused about what's what. If you have any questions or concerns, make sure that you of course do call your midwife or your care provider. And with that loosening, you'll also probably notice that you're going to do number twos, that kind of business quite often because the muscles in around your bottom area and your intestines are also loosening. Also, pelvic down, you're probably weeing a lot. Although sometimes your baby can actually cut off the pipes there and you feel like you need to wee, but you can't wee. It's a little bit uncomfortable and a little bit frustrating. I found if I stood up and down on the toilet a couple of times or just wriggled around, my baby would eventually move and then I would be able to go to the toilet like I needed to. Now make sure you rest up whenever you can, because I know you've probably had some pretty uncomfortable nights or some restless nights or some unsettled nights with thinking about what's to come, which is completely normal, but do rest where you can. Snack often so that you are fueling your body in preparation for labor when that big time comes. And like I said, look out for signs of early labor. Some women will have already been having the signs and are maybe having them now as they're watching me. If you're like me with my second pregnancy, I was actually in practice labor on and off for about 4 weeks. So there was 4 or 5 times when I would have contractions in my belly for around about 12 hours. They would get to 2 minutes apart and then they would miraculously stop. Then when I went into actual labor with my beautiful second daughter, Indiana, at just over 40 weeks, I knew it was coming because it was very different. They were all in my back and she was actually spine on spine at the time. So some ladies have already been practicing to go into labor, but look out for signs such as cramps in your uterus, cramps in your back, of course your bloody show, or the losing of your mucus plug, of course, and just have a look and a feel and see what's going on, because you may just be feeling some tightening. So it's a really nice idea to get in touch with your body, and of course let your partner know what's going on, your birth partner, because it is their job to keep an eye on you. And if you're not sure what's going on, then just make sure you call your care provider and ask. Now, one thing I was going to talk to you about today, because nobody told me this, ladies, is a little thing called transition. Now, when I went into labor with my second baby, I found that I was really sleepy in between contractions for the first couple of hours. So as I was starting to dilate the first few centimeters in between contractions, I was quite sleepy. I would wake up from my contraction and then find that I would go back to sleep again. And your body actually does this in some cases to try and help you to conserve energy. And then I found all of a sudden that my contractions, in between my contractions, I was alert, I was awake, I wasn't sleepy anymore, and I felt kind of scared. And what I found out afterwards is that this is a thing called transition, and it's your body's natural way of actually keeping you safe. So if you can imagine animals out in the wild, they need to run away because obviously there are predators out there. So this is a time when your body's preparing for you to deliver your baby and its primitive instincts kicks in and it's getting you ready to actually pick your baby up and run to safety. So it can pump your body pumps you with adrenaline, and the side effect of that is being really awake, really alert, and also a little bit fearful. So if you find that during your labor where you go from quite calm and sleepy in between contractions to quite alert and awake, it may be that your body is going through that transition period, which is a natural period. And I just really wish that someone had have told me that, because I remember being sleepy to quite scared and actually turning into a child and begging my midwife and asking her to help me. I knew my midwife and I was like a teenager. I literally turned around and asked her why she wasn't my friend anymore, that I would help her if she was in trouble, and why wasn't she helping me when I was in trouble, to which she laughed and told me that everything was normal and I was doing just fine, and then continued to help me along with my labor. Anyway, ladies, some of you are not going to be here next week because you are going to have your beautiful, beautiful baby safely and snuggled up in your arms, to you, congratulations. And of course, please send us in your photos and let us know how you went. And for the rest of you, hang in there, ladies. Still loving being here with you, and I will see you next week for week 40 of your wonderful, wonderful pregnancy journey. We'll see you then. I'm hiding from my kids, but before you go, do you love this video? And did you want more great pregnancy information delivered directly to you? If so, make sure you just drop by and subscribe to Ready Set Mum using the links below. Good luck.